Namaskar, Adab, Sat Sri Akal. Welcome to the live session on dialysis, myths and facts. I'm your host, Dr. Sushila, and I'm delighted to have with us today Dr. Sanjiv Jasuja, Senior Consultant Nephrology at Indraprastha Apollo Hospitals, New Delhi. Sir has experience spanning more than 2 decades, having treated many patients suffering with a plethora of renal disorders and those needing kidney transplants. Dr. Jasuja is quite active academically as well. He is Professor of Medicine at Apollo Hospitals Education and Research Foundation and former Adjunct Professor at School of Medicine, University of Queensland, Australia. Dr. Jasuja is an active member of various prestigious national and international medical societies. आज हम बात करेंगे डायलिसिस के बारे में. Why is it done? क्या precautions लेने चाहिए? Tips for dialysis patients, etc. We are also streaming this podcast by the name Hello Apollo on Spotify, iTunes, Google Podcast, and Amazon Music. Thank you, viewers and listeners, for tuning in and making us grow to such large numbers. Once again, I welcome our very own Dr. Sanjiv Jasuja to our live session and podcast. Over to you, sir.
Thank you, Dr. Sushila, for inviting me for this podcast. So I'm available for you all the questions with my experience and knowledge, whichever best I can offer you. Please proceed.
So we begin with the preliminary basic question, sir. What is dialysis and how does it work?
See, when the patients fail their kidneys, they need some kind of a support system to survive. And it should be as efficient as your own kidneys. And the system which has been developed by science is called dialysis. So it works like your own kidneys, and it has three major basic physics principles on which it works. One is diffusion, second is convection, and third is adsorption. With the help of these three basic physics, it takes out all the toxins जो हमारे शरीर में pile up हो गए because of the kidney failure, वो सब निकल जाते हैं, and patient starts feeling as a patient can live almost like a normal healthy life. I have patients living on the dialysis modality for last about 2 to 3 decades, are very comfortable getting adequate dialysis. But the bottom line is a good quality, adequate dialysis is akin with a good long survival.
Is it true that dialysis is only needed for kidney failure patients?
Sushila, this modality was actually planned for kidney patients only, but then there are other conditions over the years. We as physicians have evolved. ये टेक्निक को हम बहुत सारी और चीज़ों में भी यूज़ कर सकते हैं. इसको हम क्रिटिकल केयर पेशेंट्स को जब उनकी किडनी फेल होती है, जब उनकी किडनी नहीं भी फेल होती, जब वो टॉक्सिन पाइल अप करते हैं तो उनको हम दे सकते हैं. पॉइजनस पेशेंट्स में इस प्रोसीजर का यूज़ किया जाता है. और सबसे ज़्यादा इम्पॉर्टेंट जो इसकी एब्जॉर्प्शन मोडालिटी को हम यूज़ कर रहे हैं आजकल, खास करके जब मैं एबीएन कंपैटिबल ट्रांसप्लांट करता हूँ, उस ट्रांसप्लांट मोडालिटी में भी इसी प्रकार के एक परियोजना जिसमें हम काम करते हैं, जिसके जरिए हम ब्लड ग्रुप के कण जो आपके डोनर के साथ नहीं मैच करते, उनको निकाल के एक इस प्रकार का डायलिसिस करके हम आपको बहुत गुड क्वालिटी ट्रांसप्लांट देते हैं. इससे डोनर नंबर बढ़ जाता है. तो एक ये हो गया. अपार्ट फ्रॉम दैट देयर आर डिजीजेस व्हिच आर रिलेटेड टू न्यूरोलॉजी, देयर आर डिजीजेस व्हिच कम फ्रॉम rheumatologists, and there are diseases which come with the immunological profile. So वहाँ पे भी cleansing करने के लिए हम dialysis modality को use करते हैं.
Right, sir. And what are the different types of dialysis, and how do you decide which one is appropriate for the patient?
See, there are two main varieties of dialysis. Then there are some varieties among these only, but the first is hemodialysis. This is a blood, what we commonly call as a blood dialysis, जिसमें मरीज का blood निकाला जाता है, उसको साफ करने की प्रक्रिया के गुजार के उसको वापस पेशेंट के शरीर में डाल दिया जाता है. दूसरा एक पेरिटोनियल डायलिसिस होता है, जिसमें हमारे पेट के अंदर एक नेचुरल बैग, जो पेरिटोनियल बैग बोलते हैं जिसको, वो हमारे पेट में मिला हुआ है, उसकी जो झिल्ली है उसको हम उसकी प्रॉपर्टीज को एक्सप्लॉइट करते हुए मरीज को डायलिसिस करते हैं. इसमें एक कैथेटर डाल दिया जाता है और मरीज अपना डायलिसिस कर सकता है. अब इस मरीज को क्या डायलिसिस देना है, ये एक अपने आप में एक साइंटिफिक जजमेंट वाला इशू है. इसमें हर मरीज को हर दोनों प्रकार के ऑप्शंस नहीं दी जा सकती, कुछ एक कॉन्ट्राइंडिकेशन होती है, बट लार्जली आई वुड से मोस्ट ऑफ द पेशेंट्स can opt for either of the two options. But then if you don't fit into a contraindication जो आपके लिए ठीक नहीं है, वो आपके नेफ्रोलॉजिस्ट या डॉक्टर आपको बता सकते हैं और आप उस प्रक्रिया के अंदर जाके अपनी लाइफ को कंटिन्यू कर सकते हैं.
How long does a typical dialysis session last, sir?
See, when we talk of hemodialysis, a session of hemodialysis lasts for स्टैंडर्ड केयर में 4 आवर्स के लिए होता है. मगर आजकल इसका एक एक्सटेंडेड वर्जन आता है जिसको हम स्लेप कहते हैं, जो क्रिटिकली सिक पेशेंट, हाइपोटेंसिव पेशेंट्स और जो हेमोडायनेमिकली अनस्टेबल पेशेंट्स को दिया जाता है, जिसमें इसकी जो ड्यूरेशन है उसको हम 4 घंटे से 6 घंटे, 6 से 8 घंटे, सो दैट जो डिलीवरी है वो जेंटल हो जाए और पेशेंट उसको टॉलरेट कर पाए. जहाँ तक पेरिटोनियल डायलिसिस का सवाल है, उसकी जो ऑप्शन है वो 2 प्रकार से. एक तो बहुत ही फिजियोलॉजिकल है कि आप अपने आप को मशीन के साथ रात को कनेक्ट करके सो जाओ और मशीन आपके पेरिटोनियल डायलिसिस करती रहती है, जिसको हम एपीडी कहते हैं, ऑटोमेटिक पेरिटोनियल डायलिसिस. और दूसरी पद्धति में मरीज को एफर्ट खुद या उनके को अटेंडेंट को खुद एफर्ट लेके एक्सचेंज वॉल्यूम चेंज करना पड़ता है, जो कि 4 से 6 घंटे के दौरान के अंतराल पे किया जाता है. दिन में 2 या 3 बार 20 से 30 मिनट का की प्रक्रिया लगती है. मगर पेशेंट के का डायलिसिस more than 12 hours invariably चलता रहता है.
Okay. And can this be done at home? You have partly answered the question that peritoneal dialysis can be done at home, but can hemodialysis also be done at home?
Yes, with the current advances, home hemodialysis has become a very, very important modality. There are patients who would like to have their own system at home. The water qualities can be, now the small RO systems have come which are compatible to be kept at home, unlike the earlier large big size RO systems which are only could be kept in, since they were occupying a lot of space, they were only meant for the hospitals. But we have a small RO systems, portable dialysis machines which can carry out, execute as efficient dialysis as the hospital required. But rather, if you go by my experience, and my patients who are getting home hemodialysis, they are rather doing better than the patients coming to the hospital. A, probably there's a lot of encouragement of their own environment. B, adequacy of dialysis is a very important factor. Invariably, when you have to come to hospital, you have to look after your multiple logistics, your support system, your driver, your car, your hospital timings, and then the waiting periods. In home environment, none of this is required. I mean, you can choose your time. You can start your own dialysis. You can take a help trained at home. You can ask for the technician to come home and do your dialysis. So that way, home hemodialysis is picking up in the country. A lot of patients are getting this option also.
Yes.
Plus, peritoneal dialysis, as I already have said, it's largely carried out in home, but then peritoneal dialysis can also be done in hospital. That's also true.
Yeah.
For acute peritoneal dialysis, we do in hospital. The patients who don't tolerate hemodialysis and they're already carrying out peritoneal dialysis at home, once they're admitted for some other reason, we execute the same. So these are mutually exclusive. You can do at home, you can do at hospital, wherever you want.
Are there any side effects or risks जो कि डायलिसिस के साथ associated रहते हैं?
Sure, you know, science has all the science and flip side, but a well-executed plan has almost takes care of most of these flip sides. So if you take care of a proper planned dialysis and keep discussing with your care provider, particularly the nephrologist, regarding your issues, I don't think there's any risk involved more than not getting dialysis. So not getting dialysis makes your life almost non-continuous kind, and this gives you a life. And I have patients, as I said earlier, they've been 2.5 or 3 decades. They are doing it so that they are the proof of the facts that dialysis is a wonderful modality if executed properly. See, the dialysis, any amount of dialysis, whether you do hemodialysis or peritoneal dialysis, cannot substitute your natural kidneys, because your kidney works 24 hours 7. Every minute they are working. Moment there is a bad element generated which is not required in the body is discarded instantly, like acid, any electrolyte which is not required, like potassium, calcium, everything is clean, and urea, creatinine, simultaneously. So the dialysis is an option which you can't put your patients on round the clock on a system which continues to operate, and they don't have a normal natural life. So the science has evolved a quantum of the dialysis which, if delivered, can give almost नॉर्मल लाइफ. तो आप अपनी लाइफ को सुचारू तरीके से लंबे तक चला सकते हो अगर कम से कम, अगर डायलिसिस हेमोडायलिसिस की बात करें तो कम से कम 12 से 14 घंटे पर हफ्ते. पेरिटोनियल डायलिसिस करें तो 8 से 12 घंटे पर डे का सेशन अगर लेते रहते हैं तो आप पूरी लाइफ अपनी अच्छे से निकाल सकते हैं. Now, how long it is to continue, that's as long as you're alive or until you get a transplant. Once your kidneys have failed, you have to have some kind of substitution, either dialysis or a transplant.
Right. Are there any dietary restrictions or guidelines that a patient or dialysis is advised to follow?
Actually, there are some standard guidelines, but they cannot be generalized for all the patients. Individual patients have their own dietary variations depending on their protein content, their muscle mass, their age, their growth quotients. So everything is put together, and that's how, as a physician, we advise the dietary management. But broadly, most of the patients, once you're on hemodialysis, may drop their urine output. So water consumption or the liquid consumption has to be limited. That's one part. Second thing, if you have a comorbidity like diabetes, it has its own diet plan which you need to continue as before. And if you've got a blood pressure, you need to restrict your salt intakes also. Then potassium is another important element which can come to a level which is dangerous for your cardiac rhythms. So if it can disturb, so diet has to be low in potassium. So these are the broad guidelines which we have to follow. Apart from that, phosphorus content, particularly in Indian diet, when we are using pulses and milk-based products, is pretty high. So that would also warrant some kind of medical management and some drugs which will control the phosphorus, plus adequacy of dialysis, plus the restrictions. Once all these three are in place, I think most of these patients in initial few months understand all these points, and then thereafter there's never a major issue.
Sure. So can it be reversed or stopped once started? Is this a
Yes,
permanent?
yes, we do it very often for our patients. Those who have an option of a transplant, I offer them transplants which are right from regular dialysis transplant. We give them immune compatible transplant. We offer them a cadaver transplant. It's patient's choice. If he has an option, and he's fit to get for the next level for execution plan, particularly the transplant, unless he's super sensitized or is hypersensitized for other human tissues. So those are the few contraindications. Or if his cardiac disbalance is so much that he can't undergo a major surgery, a majority of other patients have other options, which I offer them very often, like a transplant.
Are there any alternative treatments or therapies that can be used other than dialysis?
There are
Or
two. See, as I just my previous question
mention transplant? Yes.
answered, which I have just answered. The transplant is a wonderful modality once it is offered, whether compatible or immune compatible, or we are offering them cadaver transplant. All these are actually
Yeah. Yeah. Yeah.
bring you out of the dialysis proportion, and you can live your life. And I would say just few words about transplant also. Because the transplant, if an option available to a patient, he must execute it. Reason
Right.
being because the 5 year survival, 10 year survival, 20-year survivals for the patients who get transplant and those patients who stay on dialysis is phenomenally different. So you can multiply your life in a better quality, more physiological, and more natural, and not so much of exertion of getting dialysis and just few pills and few follow-ups with your doctor. Makes life much smoother and easier.
Right. Right. Thank you so much, sir, for such an informative
No,
session.
I just want to add one more thing.
Yeah.
One more option which patients have started taking up these days. There are a lot, see, since these patients unfortunately are looking for options other than the conventional options, so they are
Correct.
being exploited. I've seen
Yes.
in the market some of the therapies which are no way proven in terms of their scientific uh, delivery are being offered to the patients, and unfortunately, these patients suffer badly and they get into problems. And I think patients should follow the system which has been proven and which can actually extend their life.
Yeah. So I was going to ask you, sir, कि at the end आप हमारे viewers को and listeners को क्या message देना चाहेंगे? But I think you have already covered that. This is the message that you might want to reiterate it since it is so important. कि आप हमारे
Yeah, yeah, that's true. See, the most important part, first thing is it's quite a disheartening disease for kidney disease. Once it comes, it's there to live with you. You have to pick up a choice. 3 decades back, when I started my career, such patients we used to tell them go home and just spend your time with your family. That means that is the end of life. Fortunately, the science, particularly in the kidney area, has wonderfully grown in such a way that one can complete the life journey. So there's no reason to get disheartened. Only thing is you have to fix up your priorities. You are eating food, you are taking 3 meals a day. You have to accept that you have to live your life, not only the meals, you would have to take 3 dialysis a week if you're getting hemodialysis. If you're doing peritoneal dialysis, you have to do 12 hours peritoneal dialysis. If you get a transplant, wonderful, there's no match to that. If there are family options, otherwise you can get yourself registered for cadaver transplants, or you can look for a swab transplant, or you can look for immune compatible transplant. So options are plenty now. So most of the patients, I would still again say, should choose for the scientific options. Non-scientific options, which currently are available, are actually not delivering. I've not seen anybody getting any other option which can sustain the life of these patients.
Thank you so much, sir.
Right. Thank you, Dr. Sheila.
We thank Dr. Jasuja for joining us for this conversation and leaving us with such an encouraging message. To our listeners and viewers, if you need any professional help, you can reach out to us through the details mentioned below or through our social media handles. To know more about healthcare and our upcoming episodes, do follow, subscribe, and share this message with your family, friends, and loved ones. We'll be back with another specialist discussion on another interesting topic next week. For any suggestions regarding the topic discussed today, DM us on our social media handle Apollo Hospitals Delhi. We'll be happy to connect. Till then, stay happy and healthy. Thank you. This is your host, Dr. Sushila, signing off.